Hello and welcome to the presentation of assessment and treatment planning of alcohol. In this presentation, I will quickly cover up screening, brief intervention, and medication. What is alcohol dependence? We all have seen people who can easily give up alcohol when and where they want it. But there are people who has difficulty in stopping alcohol in spite of the persistent physical, psychological, and social harm. These individuals have strong desire to take the substance and they have difficulties in controlling the use of alcohol. So whenever a patient or a person comes to a health provider, the best quick screening for alcoholic can be CAGE questionnaire. The C stands for cut down. So one can ask, have you ever tried to cut down on your drinking? Usually the alcoholic loss of control over drinking issue can lead up to this question as yes. And then you move on to your second question, which is annoyed. Have you ever been annoyed about friends or family criticizing over your drinking? So the severe alcoholics are often not only criticized by loved one, but sometimes they are criticized for their drinking habits in the office also. So what is G? G is for guilty. Have you ever felt a little guilty about your drinking? Again, a positive response can give us a view that the person is dependent on alcohol. So our final question is E. E is eye-opener. Have you ever needed a drink first thing in the morning to study your nerves or get rid of a hangover? So these are the 4 questions which are very important for screening of an alcoholic. The treatment plan can depend on the severity of the alcohol problem. If for the low level of alcohol problem, we can do the brief interventions. And for the moderate to severe level of drinking, we can have the intensive treatment interventions. For example, we can ask for the medications or the hospital admission. So alcohol treatment plan do change according to the consumption of the alcohol. So here I have mentioned the harm minimization strategies. Harm minimization strategies, it says that alcoholic cannot leave the alcohol and say that he's completely stopping the alcohol. But what he or she can do in the case of alcohol, you can encourage the person to have 1 or 2 glass of wine at a time rather than having a full bottle. So this is the way we can minimize the harm. Or in the event of accident due to alcohol, what usually happens, people go for a night pub, and what they do, they drive themselves to the home. What happens at that time when they are fully intoxicated and driving the car? So obviously it can lead up to the accident. So you can encourage the person that instead of taking your own car, you can have a cab or ask some of your friends to help you to going back to the home. So these are the harm minimization strategies you need to think in cases of alcohol. Now moving on to the brief intervention. Now the brief intervention are of various types, and I would like to say that the brief interventions are primarily educational intervention that can be delivered in the session of 5 minutes up to the 30 minutes. They are typically single session intervention, but a follow-up session is strongly recommended to ensure that behavior change has occurred. A brief intervention is appropriate for an individual with excessive drinking habit and who have few medical problems. So while you see that this flag is a very good tool uh, to ask the patient or the person. So the first is the flag. F stands for feedback. You have to ask about the current drinking pattern, problems, and health status. The L stands for the listen. Here we have to listen to the patient's response and to discuss the patient's consumption level and how it relates to his problem. Advice. Now, the advice is something we talk about the changing current drinking pattern, but these advice should be in a very non-judgmental way. The next step is your goal. The next acronym is G, and the G is for goals. Goals are where you discuss the safe drinking limits and you assist the patient to set goals for changing drinking pattern. And the patient should, one must encourage patient to develop, implement, and commit to plan to stop drinking. The strategies can be the practical strategies to reduce your drinking, such as switching to a low alcohol beer, or one can plan an alternative thing instead of socializing to the people who are encouraging the person to drink actually. Now, alcohol withdrawal. Alcohol withdrawal is a very vast chapter or a topic to discuss. So I'm quickly giving you an overview here that individuals who regularly drink large amounts of alcohol may experience a withdrawal symptom when ceasing or reducing their alcohol use. Alcohol withdrawal can result in severe and life-threatening complications, for example, seizures, delirium, if poorly managed. So I would say that if a person is very severely dependent on alcohol, please transfer the patient to the hospital because there is a probability of seizures, alcohol withdrawal seizures. This usually occur in 6 to 18 hours after last drink. Alcohol withdrawal delirium usually occurs 2 to 5 days after last drink. And alcohol withdrawal hallucination can occur at any time during the withdrawal. So one needs supportive care and medication. So what are the medications we have? The medication generally we talk about are two. These are naltrexone and acamprosate. So the naltrexone in the context of alcohol dependence is thought to reduce the release of dopamine, which decreases the positive reinforcement of craving. Its opioid receptor blocking effect is thought to reduce the high association with drinking in those who relapse on this medication. On the other hand, the acamprosate is a GABA receptor agonist. It mimics the effect of an inhibitory neurotransmitter. It is thought to act primarily through decreasing neural excitation in alcohol withdrawal, and it reduces the craving and distress. So, moving on to our disulfiram, which is an anti-alcohol medication. The disulfiram inhibits alcohol metabolism, resulting in accumulation of acetaldehyde. The reactions are very severe and require hospitalization and supportive measures. The reaction includes flushing, chest pain, vomiting, tachycardia, and hypotension. Hence, it is very, very important to understand that we need informed consent and motivation on the part of the individual in the treatment plan. So, what are the relapse prevention strategies? The relapse prevention strategies is influenced to a large extent to the person support group and the lifestyle of the person. So, one of the useful strategies can be distraction, decision, and delay. In the distraction, we encourage the individual to distract himself by going for a walk or making a phone call or watching a TV. For the decision, encourage the person to reaffirm his or her decision for the change and tell him what happened if he again relapse. He has to go for by this process again. Delay is the craving usually there and it lasts for the minutes only. So ask the individual that if he delayed this whole process, he can win the whole um, cycle. So delay is one of our important thing which need to be emphasis while we are talking about the relapse prevention. One of the important aspects is support for the family. Often we think that alcohol is an individual problem. We are treating one individual only. However, it is not true. A person is also a husband, a father, and there's a great impact when a person is chronically using alcohol. The family members or the friends, they they are also living and experiencing the same emotional trauma. So one must think about to support the family. Thank you very much. I think this presentation will help you in some way. See you.